Chapter 24 covers hematologic and renal emergencies. First, we'll talk about the hematologic system. First part, blood clotting. Aggregation of platelets. That's the body's most rapid and initial response to stopping bleeding. That is the clotting process. The clotting factors, which is just basically just a group of proteins produced by the liver, released in the bloodstream. Once all that's activated, the clotting process begins. So, the aspirin that we give patients is a platelet aggregate, so it prevents clots from forming in cardiac emergencies. Coagulopathies is referred to as a condition which is abnormal clotting in blood. It can occur when body forms clots too quickly or when they clot too slow. There are certain diseases which can make a patient prone to such poor clotting as advanced liver disease, since the liver is what releases all the proteins to form clotting, hemophilia, and von Willebrand disease. Now, how to identify patients with coagulopathies. Certain medical conditions and medications will lend into this. If a patient is on a prescribed blood thinner, that patient has coagulopathies. Patients who are on blood thinners, more serious to life-threatening bleeding when injured, more than patients not on those medications. So a big thing to ask is any kind of trauma patient or patient who is bleeding, ask if they are on any blood thinners to know if you're going to have a hard time controlling their bleeding. Anemia is the lack of normal amount of red blood cells. It can be acute anemia, just a sudden blood loss, or it could be chronic. Such patients may have excessive menstrual periods, slow GI bleeding from chronic ulcers, things like that, or diseases affecting bone marrows. Some patients who are anemic will have blood infusions regularly, so asking, when's the last time I had a blood infusion or transfusion will help you identify ailments of the patient. Sickle cell anemia is a genetic disease that affects red blood cells. It's most prevalent in minorities of African Americans and Indian or Middle Eastern descent. Basically, the defective shape of the red blood cell resembles a sickle, so that's how it got its name. The cells have a short lifespan, which will lead to anemia. Complications given that is destruction of spleen, sickle pain crisis, severe global pain, acute chest pain, priapism, meaning just spontaneous erections, a stroke, jaundice, or other issues that can go into major clotting stuff or emboli, such as strokes, pulmonary embolisms. 1 in 12 African Americans does contain the sickle cell trait, but it doesn't always lead to complications. Possibly they are able to lead a normal life if they do have a sickle cell trait. They may not have any complications whatsoever. Basically, supportive care, give them oxygen, do good thorough assessments, checking for hypoperfusion, and see if there's any clotting anywhere causing strokes, any kind of perfusion issue, whether to the brain, heart, or lungs. And if they are having such instances, transport them to the appropriate facility. Next, we'll talk about the renal system. Components of the renal system: you got 2 kidneys, 2 ureters, and 1 urethra. The job of the renal system is for filtering blood and removing the waste. Helps maintain your fluid balance and that pH balance within the body. Diseases of the renal system can affect different portions of it and range from anything very little as to life-threatening. A UTI, most common disease that afflicts renal and urinary systems. Being an infection is just caused by bacteria and generally just focused and limited to the bladder. It can cause pain, frequent urination, and with that they'll generally be fevered, have a strong urine odor, and possibly an altered mental status. So asking those patients some questions of any change in bathroom habits, if they've had really dark, strong odor smelling urine, generally going to be a UTI. With that, just going to be supportive measures. Kidney stones are made of calcium and form within the kidney. When in the kidney, they cause no symptoms. It's just when they get moved and dislodged, they can cause flank pain on one side or the other. Generally will be around the kidney, going right down to the groin. They also may be experiencing nausea and vomiting. Some patients may have urinary catheters due to renal obstructions of the bladder. So they're just having a hard time. They can't pee by themselves, so they've got a tube in there that just lets them pee into a bag. Or from neurological issues, if a patient's maybe had a stroke, bed confined, basically patients who are near comatose all the time have urinary catheters in place. It's just in place. The tube that goes into the urinary tract and everything empties out into a bag. They are very prone to getting UTIs and having infections and stuff like that around the sites of a catheter insertion. Renal failure is basically failure of the kidneys. The kidneys have lost their ability to filter and remove the toxins, being their job. Acute failure typically results from shock or toxic ingestion. Some patients who have had major overdoses will be in acute renal failure and have to receive dialysis, or if they've been in severe trauma, loss of blood loss, they may have to experience dialysis that the kidneys have temporarily failed. And chronic is generally inherited or secondary damage from diabetes or hypertension. So most notably, patients who are on dialysis who receive continual renal treatment are from the diabetes and uncontrolled hypertension. End-stage renal disease is the very last stage of complete renal failure. It's irreversible. It requires dialysis, and most of them are receiving dialysis in specialized centers. Some can receive dialysis at home. This is just a temporary fix. More than 400,000 Americans on dialysis are treated in dialysis centers and undergo 3 treatments a week, each about 3 to 4 hours. So most of these people in renal failure are spending around 12 hours a week getting their blood filtered by machine, since their kidneys can't do it anymore. So a lot of transports of those dialysis patients are relied upon by EMS agencies for transport. Hemodialysis, that is the treatment that people in renal failure receive. They're connected to a machine that pumps the blood out of the patient through the special membranes of that machine and then back into the patient. So as you see by the diagram, the blood flows out of the patient, goes through a pump, in through the machine and all equipment, then back into the body. There's 2 types of access that the patient has on hemodialysis. There's a 2-part catheter or an AV fistula. The AV fistula, basically you can feel a vibration whenever you touch it. Here's a 2-port catheter. See, 1, 2 ports. Up here, generally mid-clavicular region, that's where they'll get poked, because they can't just receive a normal IV, as they've been poked and prodded and they have bad vessels and they get chronic use out of them. So it's easier just to put in a port whenever they have to have vascular access several times a week for multiple hours. Then this is the fistula. Around, you see this is the elbow and just kind of a loop in it here. So if your patient has a fistula, you do not take a blood pressure on this side so you don't damage this fistula. Peritoneal dialysis is a little bit different. This is one that can be done at home. Basically uses the peritoneal cavity of the whole abdomen region, So a special kind of fluid is put in the abdomen. It's left for several hours, so all the waste and everything that's built up in there, excess fluid, will be absorbed by this special fluid, and then later that fluid is removed, taking all the waste and excess fluid with it. Picture of the dialysis, they'll have a port and access into the abdomen. Medical emergencies that relate to end-stage renal disease. Two big groups. Basically, loss of normal kidney function and complication of dialysis treatments. So most of the patients be treated and have issues. With the ones is going to be a diabetic emergency or an issue with their blood pressure. Complications also go into that. If a patient has been very ill or didn't have a way to get to dialysis, they can become very, very sick. Short of breath, develop edema in their legs and their lungs, or electrolyte disturbances. Their pH balances could be way off. They could be acidic. Just really, really sick people if their blood's not getting filtered out. So if you have a patient who's called 911 because they've missed dialysis and they're really, really sick, basic concepts of assess the ABCs, get good vital signs, and be cognizant as fistulas so that you're not taking a blood pressure on the side of that fistula and damaging it. Give them oxygen and take the vital signs and take them to the hospital, or if you're able to, get them into their dialysis treatments. Some complications that can come of dialysis is uncontrollable bleeding from that fistula site. The body with this generally has a poor clotting effect. Can also get site infections from where that catheter has entered the body, causing peritonitis and just overall infections. If you do have any issues with that, ABCs, control the bleeding, lots of direct pressure, elevation, and use any kind of hemostatic dressings if need be. If the bleeding can't be controlled by direct pressure, then you go to a tourniquet. But most of the time with that, just a lot of good direct pressure will control that bleeding. Treat the patient's forced shock. If the patient has had complications with dialysis, they can go into shock very, very fast. Even just normal dialysis treatments can send a patient into shock just from the crazy experience of dialysis in itself. As I said, dialysis is a temporary fix as a lot of these patients are trying to be eligible to receive kidney transplants. The kidneys being the most commonly transported organs, about 16,000 transplants a year. But they'll end up spending a whole life on special types of drugs to prevent any kind of organ rejection when they do receive a transplant, and to help try to fight off any kinds of infections. But most of the patients on dialysis, once they go on it, they're in such poor health that they're not going to get kidney transplants. So they're on dialysis just to get them through a few more years of living.